Sexually transmitted disease infection rates in African American Chicago youth. This is a graph looking at the Chicago STD cases by year. In 2013, 2014, and 2015, you can see a general increase in the number of chlamydia cases in the population. The number of gonorrhea and HIV cases remained pretty similar between the years. When looking at the chlamydia infection rates in 2016, you can see that there is a large difference between the total population and those ages 13 to 19. In Chicago, there's about a 4 times increase, and in New York City, roughly 3 times, and in the US, it's a lot more than that. You can see that the number of cases in children ages 13 to 19 is significantly higher than those in the general population per 100,000. Healthy Chicago 2.0 looks at the chlamydia rates per 100,000 females aged 15 to 19. The communities in red are those that are greatly affected, with 10,749 to 8,681 cases per 100,000. These communities are also predominantly African American communities, and many of these communities are also low or very low child opportunity areas. Low or very low child opportunities are calculated through the Child Opportunity Index, where they look at educational opportunity, health and environmental opportunity, and social and economic opportunity. When looking at public school sex education policies in Chicago versus New York City, the sex education goals are very similar, where they introduce sex education in kindergarten through 12th grade, and they focus on human development, relationships, decision-making, abstinence, medically recommended contraception, and disease prevention. The differences lie where the parents or guardians are able to opt out of sex education. In New York City, they require parents to sign a statement saying they will educate their children at home with the specific goals. In Chicago, they are able to opt out, but there is no recommendation as to the parents having to educate their children. In New York City, they also have a higher number of hours per year versus Chicago with 11.25 hours. In New York City, they also have a separate HIV/AIDS curriculum where they have a set number of lessons per year from middle school to high school. With the high rates of STD infections in the Chicago youth, there needs to be policy developed to decrease the number of children affected.